Hey guys, welcome back. It's Thursday evening, 7 o'clock again, and I'm here with Clavicle Fractures this time. And I just finished operating on a clavicle fracture and I've come here to do the live. And the reason why I'm holding this bone model here is it is very difficult for anybody to understand how the anatomy of the clavicle appears without actually seeing how it looks in our body. So this is your shoulder bone, this is your arm bone, which you move. Your rib cage will be here in the middle, and on top of it is your clavicle bone or the collar bone. This bone, if you see, is important because it connects your shoulder bone, your arm bone, and it connects the shoulder and the arm to the center of your chest wall. And that is the reason why when you sustain fractures of the clavicle, the entire equilibrium of your chest wall and your shoulder can get altered, especially if this beautiful anatomical shape of the clavicle is not restored properly. All right, guys, I'm going to take this off. Okay, I'm Dr. Santosh Jacob. Most of you know me. I'm an orthopedic surgeon from the beautiful city of Chennai, Tamil Nadu in India. And I believe that information about a disease is the first step and the best step we can take towards defeating and beating that disease. So today we are going to talk about clavicle fractures. And before we start, I'm just going to show you guys a video. So this is a clavicle fracture. This is me just getting into to operate. So we use plates and screws to fix it. And at the end, the fracture, which was like this before, looks like this, beautifully aligned and fixed. All right. So now, getting back to how do collarbone or clavicle fractures happen? It happens because of trauma, because of a direct injury to the clavicle, or it can happen if you have fallen on your outstretched arm. Because when the force goes through the arm, it passes through the shoulder and hits the clavicle, and there could be a fracture. The other possibility is if there is a direct force, as I said earlier, again, it could be through a fall or it also could be through a road traffic accident. And incidentally, over the last few years, the number of clavicle fractures have been increasing primarily due to road traffic accidents. And I think over the last 1 month, we have operated more than 6 patients who had clavicle fractures. And the reason why I am doing this live show is because there was a patient of mine who I operated upon like after 10 days of a clavicle fracture. She was suffering with pain for 10 days. As she was confused about whether to do a surgery or whether to take conservative management, because she had heard both sides of the story and she was confused. I, for one, think that human beings, we can handle good news, bad news. But if there is uncertainty, we become extremely anxious. So the goal behind this video is to make sure that if somebody you know or yourself sustain a fracture of the clavicle, you know how to think, because it is becoming more and more common. All right. So we have already seen why and how clavicle fractures happen. Second thing, the most important thing for you, what to do in case you see somebody sustaining a fracture of the clavicle. So how will it appear? They will have a swelling in this region and they could also have a bump. They will have severe pain in the region of the clavicle. And if you notice, they will be supporting the arm up like this. So if you see any of these, please suspect. If you are a bystander, expect or think that, okay, this person could have a fracture of the clavicle. And the first thing you do is please do not attempt to manipulate it or set it right. Don't pull the arm, don't push it, nothing. What you do is you support the arm and try to get the arm into a sling so that it is supported. So find a rope or find some cloth through which you can tie this arm up to the neck so that it is supported, and then apply ice. Do not apply ice directly, apply it wrapped up in a cloth so that direct cold is not on the skin, because even that can cause friction burns. Okay, so if you see somebody have a clavicle fracture or any upper area fracture, this is what you do. The most important thing is do not attempt to set it right there. All right, coming to the third point. Once you have sustained a clavicle fracture, you have already had the first aid and you're going to a specialist. What are the investigations you expect? The first thing is you have to do a complete chest x-ray in order to see if there are any other associated injuries, especially if you have pain in the rib cage or areas like that, to see if there are any associated rib injuries. One. Second, if you have any pain of the shoulder, an MRI of the shoulder can be done, because studies are showing that in displaced fractures of the clavicle, where the fractures are quite bad because of high energy trauma, what happens is that when the fractures separate, see, the clavicle, as you saw, is attached to one end on your chest bone in the middle and on the other end to your shoulder. So if there is such a force that this entire bone is broken and it is separated apart, it will definitely have transferred some energy or some deforming force onto the shoulder, and your shoulder has 4 important stabilizing muscles known as the rotator cuff muscles. So you should always make sure that shoulder soft tissues are also intact. So if always assess if you have shoulder pain, and if you have shoulder pain, do a shoulder MRI beforehand, because once we put a plate, at times it becomes harder to do a shoulder MRI and identify if there is any tear after you treat the clavicle fracture. All right. Now that investigations are over, let's go to non-surgical management. Now, what are non-surgical management options? It is very simple. If the fracture is not displaced, that is, when you see the X-ray and if the ends of the bone are fixed. Now, for example, let me just show you the same video so that you can understand. So if you see, going really slowly, so I'm just going to put it again. All right. All right. So I will try to show you guys what I meant by the ends of the bone being together in certain fractures. Okay. But as of now, if the fracture has not moved away on an X-ray, there is actually no need to fix unless the person has to do some strenuous activity really fast. Say they have to travel in 2 weeks or so. At that point of time, if they are unable to travel with the sling or something, even in an undisplaced fracture, you can stabilize it. But otherwise, if the fracture is undisplaced and the person can wait for 6 weeks, ideally a figure of 8 bandage where you stabilize the fracture and the shoulder for 6 weeks is indicated, and that will heal the fracture. Now, coming to the confusing thing. When do we need to operate and why do we need to operate? Okay, before we talk about when do we need to operate, we need to understand why we need to operate. And in order to understand why we need to operate, we need to understand a little bit about the anatomy of the clavicle. So the clavicle is a very strong bone. The reason is that it protects the upper part of the lungs. Okay, that is, the ribs are there, and beneath the ribs, the lungs are there. But in between the clavicle and the ribs, there are a lot of blood vessels which move in that area. That is one. Second thing is, if you see, the clavicle is attached onto your chest muscles, okay, the pectoralis major, and to the neck muscles on top. It is also attached to the strong deltoid muscles on the side. So if there is a displacement, okay, it will not reduce on its own because of the pull of these strong muscles. And if you see, we have two clavicles, yes? So if any fracture will heal, okay, the clavicle also will heal. The reason why plating has become so popular is that it restores anatomy, it restores alignment, and it restores shape. So imagine, even if your clavicle heals fully, but if it is up and down, what happens is the attachment of these muscles on this side, your chest muscles, your deltoid, your neck muscles, everything is not the same as on the other side. And that will make this limb different biomechanically than your other anatomical limb, because our muscles are used to having a certain size of bone. So if there is either a reduction in size, or if there is a lengthening, or if there is an alteration, it affects the biomechanics of the entire chest wall. And that affects people who want to work out, who want to do outdoor activities, who want to play. Studies show that it reduces the strength of the throw when your clavicle is not equal to the other side. If there is a lengthening or a shortening, we find it extremely difficult to execute arm power, shoulder power. And that is the reason, if you are somebody who wants complete strength of your upper limb, then you have to definitely talk to your doctor and ask if it is a displaced fracture, and if it is, even if it heals, what is the possibility of it healing like the other side? If the possibility is good, even if it is 80%, go for a non-surgical treatment. But if it is less than 80%, if there is a possibility that your fracture will heal a little bit non-aligned, that means that you are changing the insertion of all the muscles also. So even when you exercise, this side, the muscles will be attached differently, that side, the muscles will be attached differently, and it will affect every joint below the clavicle, because that's how our muscles work. And this is the reason why we have to do surgeries sometimes in clavicles which are not fixed. All right, guys, I'm going to end this with another video. This is a video of the surgery which I just finished before the live. Very thankful for my team to have shot the video so that you guys can see it. I'm just adding it to the stream now. Yeah, so this is what you see. So if you see, again, this video is going really slowly. Yeah, so I'm going to play it again. Yeah, so if you guys see, here is the fracture clavicle. So in this, yeah, so then on X-ray, when you see, both the ends are not together. One is completely separated. These are the plates which we used. And this is the live imaging which I use on table. This is after the fracture is fixed. So if you see that the bone-to-bone contact is very, very good. All right. So I hope that I was able to communicate or clarify how you have to think about treating fracture of the clavicle. See, orthopedic surgery has changed from restoring function to giving function to do peak performance. So if you're somebody who's an active person, especially if you work out, a fracture of the clavicle, if it is mal-aligned, could cause pain when doing simple exercises of the upper body, like push-ups or pull-ups. It could really hurt. So find out if non-surgically, just by alignment, your anatomy will be 80% of what the other side is. If it is so, non-surgical. If your alignment might not be 80% the same as the other side. Say it'll be shorter or longer, or it'll be malaligned. Then it's a decision you have to take whether you would like complete movement of your arms or you're okay for losing a little bit. That is it. Okay, guys. If you have any doubts specific to this, please let me know in the messages and I will clarify it for you guys. Okay, bye-bye. I'm just going to see if there are any comments there. Hi, Sandamil. Good evening. Aditya Jha, thank you very much. Arunan, thank you very much for watching the show. All right, bye-bye. Take care, guys. Signing off from the beautiful city of Chennai, Dr. Santosh Jacob.